I had the pleasure of treating Trevor this week, and when I was examining, I had the pleasure of treating Trevor this week, and when you hear me examine him, you'll hear me ask. Now, the reason why we do this is naturally, as human beings, we tell wonderful stories, and we tell ourselves stories about what is to come. For example, one underlying narrative might be, this is hard, I need to brace myself for it. The difficulty with this is you naturally brace your diaphragm, you contract your pelvic floor harder than it needs to be, you get more rigidity than is needed, and this can actually increase the likelihood of us suffering from an injury. Research shows that the more confident and the more relaxed that we go into movements, it tends to be that we're far less likely to experience pain or an injury. What you'll see me do with Trevor is, or what I will advise you to do, for example, what I'll advise my client to do. What I often advise my patients to do is to focus on their breath as they're moving. This does a couple of things. One, it's very difficult to be tense with a very nice, controlled, relaxed breath. Even harder to whistle at the same time as moving, which is why I'll often instruct my patients to whistle as they're moving to cue them into a deeper state of abdominal and diaphragmatic relaxation. The other reason is the breath. If we focus on it, it can anchor us into the present moment. This hinders our ability to tell ourselves narratives, which means that we're more able to be at one with the movement, going to a flow state, less likely to tense and less likely to cause harm. It is practice. It does need a bit of work to get used to this because it's undoing a lot of our, say, cultural narratives, which is that you should be rigid, you should tighten yourself up before you lift something heavy. Most of the time, this isn't the case. If you want to know a little bit more about what I'm speaking about, then you want to look up pain science, cognitive functional therapy, acceptance commitment therapy, and there's also the acronym NAME, which is to notice, acknowledge, make space for, and engage, which is an acceptance commitment therapy narrative. My name's Elliot. I'm an osteopath at the Revitalize clinic specializing in chronic pain. And if you are interested in knowing more about your health and fitness, or about how you can become mentally well, physically fit, then drop us a message. Check out our free courses on our website, www.revitalizeclinic.co.uk. Thanks for watching. And you'll probably find that if you stay nice and relaxed when you're moving, you'll feel more comfortable, less tired, and less likely to cause pain.